So let's begin the session. Come on, we'll start with simple things and we'll start building bigger and bigger castles with the help of microbiology. Pick the microbes causing human disease and contain either DNA or RNA, but not both of them. Which one is it? Bacteria, moles, protozoa, viruses, yeasts. Which one? A simple question to start with. Just tell me which one has either RNA or DNA but not both. Excellent, Stardust. You have guessed it right. The answer is a virus. Now remember, in case of bacteria, you will be having them as prokaryotes. Of course, they are prokaryotes. And these prokaryotes can actually have both DNA and RNA. Now, when it comes to protozoa, they are even more highly evolved compared to that of bacteria. Remember, for all those uninitiated people who are not actually focusing much on microbiology, remember the word protozoa does not mean they are prokaryotes. Protozoans are highly evolved organisms. They are eukaryotes. They evolved earlier, but they are not as old as bacteria. These are eukaryotes. Now, what about the moles and what about the yeasts? Moles are multicellular, while yeasts are unicellular. But both of them are fungi. Now, you please tell me, are the fungi eukaryotes or prokaryotes? Hello, Pharma Guru. Thank you. Hello, Hemash and Nonathan. Thank you for joining us. Tell me, fungi are eukaryotes or prokaryotes? It's a simple question, right? Are the fungi prokaryotes or eukaryotes? They are eukaryotes. Yes. Thank you, Narendra and Stardust. Both of them are eukaryotes. So obviously, they also will contain both DNA and RNA. Now, what is the importance of viruses? Viruses are neither eukaryotes nor prokaryotes. The virologists will say they are not even living organisms. They are just infectious particles which carry a covering called as capsid and they have a nucleic acid. They have a covering called as capsid and nucleic acid. Some of them will have an envelope which can be derived from the host cell membrane. But apart from that, you will be using DNA and RNA as the nucleic acids for classifying most of the viruses. See, you will be having either DNA viruses or you will be having RNA viruses. What is the MCQ point you have to know? See, in case of SARS-CoV-2, what was the definitive investigation done all over the world? In SARS-CoV-2, what was the definitive investigation done all over the world? Excellent, RT-PCR. Now, the word RT-PCR means reverse transcriptase PCR. This is done in case of RNA viruses for the rRNA targeting. You'll be going for RNA viruses. Now, when it comes to DNA viruses, instead, if at all you are having a pandemic because of DNA virus, then just PCR would have been famous. But because they're RNA viruses, RT-PCR had become famous. Now, here is an understanding that all the SARS-CoV-2 viruses are RNA viruses, while happy viruses like herpes, hepatna, papova, parvo, and adeno, and pox. These viruses, the 6 major viruses groups are actually DNA viruses. In all these conditions, PCR would be done. I repeat, herpes, hepatna. You say happy viruses, herpes, hepatna, adeno, papova, parvo, pox. All these are DNA viruses where RT-PCR can be done. In case of the RNA viruses, you'll be doing, in case of RNA viruses, you'll be doing RT-PCR. Now, here you have to understand the viruses are classified as either RNA viruses or DNA viruses. Now, let me ask you a quiz question or a very intelligent question. Tell me this. Which virus has both RNA and DNA? RNA and DNA containing virus. Which one? Which one contains both RNA and DNA viruses? Let me tell you, I'm pretty sure it is not very common. They are mutant viruses and they are tyrant viruses, the rebels. Mutant, tyrant viruses are the only group of viruses which can have both RNA and DNA. Now, let's go for this question. Now, this is a conceptual question. Try to see whether you'll be able to answer this. Okay, now look at this. Some bacteria are obligate anaerobes. Which of the following statements best explains this phenomenon? We are focusing on obligate anaerobes. Now, option A, They can produce energy both by fermentation, the Krebs cycle, and cytochromes. Option B, they cannot produce their own ATP. C, they do not form spores. D, they lack superoxide dismutase and catalase. E, they do not have a capsule. They do not have a capsule. Which one? Mukundan, retroviruses are RNA viruses. See, most of the retroviruses are, Mukundan says there is retrovirus. See, retroviruses like lentivirus group, it can be either HTLV virus or it can be HIV. Both HTLV and HIV viruses are RNA viruses. When it comes to the hepatitis B virus who has a retroviral enzyme, the hepatitis B contain retroviral enzyme, but the hepatitis B is a DNA virus. So they are not both RNA or DNA. Okay, answer for this question, anybody? Some bacteria are obligate anaerobes. Which of the following statements best explain this phenomenon? A, B, C, D, E. Okay, so Stardust says B. Anybody else? Okay, let me tell you this. I'll make it a very simple concept. Try to understand this. Use this for the rest of your lives, not just in your exams, but also in good, Narendran, very good. So use this even in your clinical practice. That is very important. Look at this part. Point number 1. We have the classification of bacteria based on their ability for utilizing oxygen. First, we have strict anaerobes, that is obligate anaerobes. Evolution-wise, these are the first group of bacteria to ever have an appearance on the planet Earth. They are strict anaerobes. And later, who are the strict anaerobes? Those who cannot tolerate oxygen. They cannot tolerate oxygen. Second, next, you will be having at the other spectrum will be strict aerobes. And what does strict aerobes means? They depend on oxygen for survival. Depend on oxygen for survival. Point number 1, they cannot tolerate oxygen as strict anaerobes. The strict aerobes are those who depend on oxygen for survival. Now, at this point, you have to remember, whenever you go for the strict aerobes to strict anaerobes to aerobes, you will be having slow evolution, right? After strict aerobes, the group of organisms that came into existence were microaerophilic. They were microaerophilic. Next, you had facultative groups of organisms. Now, in case of the ascending or descending nature, from strict anaerobes, the next group of organisms were facultative aerobes, and the next group of organisms were facultative anaerobes. Remember, facultative aerobes are less aerobic than facultative anaerobes. Now here comes the logic. What is the meaning of the word facultative? Facultative means if the situation demands. If the situation demands. If I call an organism as a facultative organism, be it facultative intracellular, extracellular, or facultative aerobic, anaerobic, the word facultative means if the situation demands. Now, when I say facultative aerobe, it means if the situation demands, the organism is aerobic. Otherwise, normally it is anaerobic. Facultative anaerobe means if the situation demands, the organism is anaerobic. Otherwise, the organism is aerobic. This is what I want you to remember. Now, let me write examples of each of them. Now, remember these examples. This will actually help you in cracking any kind of question based on aerobicity very fast. It can help you crack those questions faster. Do not forget them. Strict anaerobes, the world's most evolving organisms or the most phylogenetically oldest organisms, right? Who are the strict anaerobes? Point number 1. You speak of gram-positive anaerobes. You have gram-negative anaerobes. The gram-positive anaerobes are Clostridia. And if you look at filamentous gram-positive bacteria, then think of Actinomycetes. Now look at gram-negative organisms. In case of gram-negative organisms, think of Bacteroides. Bacteroides is a gram-negative organism which is a strict anaerobe. Who else? There is a cousin brother of Bacteroides called as Fusobacterium, who is also anaerobic. Now, anaerobic organisms are those who cannot tolerate oxygen. Then who are microaerophilic organisms? They can tolerate oxygen. They are not like strict anaerobes. They can tolerate oxygen. But how much can they tolerate? They can tolerate micromolar concentrations of oxygen. They can tolerate only micromolar concentrations of oxygen. Now, facultative aerobes and facultative anaerobes will have a similar thought process. They can actually be. Now, if I'm saying who is more aerobic, facultative aerobe or facultative anaerobe, you tell me which one is more aerobic, facultative aerobe or facultative anaerobe. Which one is more aerobic? Which one is more aerobic? Excellent, Stardust, Rahul Gagare and Sadaf Moment. Both of them. That is, your facultative anaerobe is more aerobic. So it means facultative aerobes are less aerobic than that of facultative anaerobes. Now, how is facultative aerobe better than microaerophilic? They are more aerobic than aerophilic. So, if microaerophilic organisms can tolerate oxygen at micromolar concentrations, facultative aerobes can tolerate oxygen at normal concentrations. Tolerate oxygen at normal concentrations. That is the beauty of facultative aerobe. Now, let's look at another slide. If I say it is facultative anaerobic, it is even more aerobic. Now, what will it do? It not only tolerates, it tolerates oxygen. Apart from that, it utilizes oxygen. It utilizes oxygen for ATP synthesis. Now, what about strict aerobe? Strict aerobe is somebody who can tolerate oxygen plus utilize oxygen plus they depend on oxygen for survival. Depend on oxygen for survival. Now, what exactly chemically tells them which organism is which? Look at this part. Strict aerobes are those organisms. Strict aerobes. Strict aerobes are those organisms who are living in the presence of oxygen. Oxygen is toxic. Remember, for the rest of your lives, oxygen is always toxic. We are breathing in oxygen. So you may think it is good for us. Yes, of course, we need oxygen for survival. But why do we need oxygen? Whenever oxygen goes inside, the fuel is getting burned. The fuel turns into carbon dioxide using oxygen. So whenever you take oxygen inside, you are burning something. Even yesterday in biochemistry, when we had fatty acid synthesis and fatty acid oxidation, the fatty acid synthesis means you're forming something complex, which is actually anabolism, while fatty acid oxidation is burning something down, which is catabolism. So remember, oxidation is always catabolism and synthesis is always anabolism, which is reduction. Now that would mean to say that whenever oxygen has been played, yes, Vasant Philip Abhishek, Vanakkam. Now, whenever oxygen has been used, it is trying to burn something down dramatically. That means if an oxygen is actually playing through electron transport chain to give you ATP, in that process, oxygen can always produce free radicals. These free radicals are dangerous because they may be having a single unpaired electron on the outermost orbital. If I say this, there is a single unpaired electron in the outermost orbital which can pierce through the membrane and they can destroy a membrane, because of which you have oxidant damage. We have oxidant damage. Now, of course, it might slightly be boring for you, but if you can actually survive the next 30 seconds, I'll tell you clinically how you can use this information in solving a case in a patient. That is what I want from you. Now, look at this. We have strict aerobes, so they depend on oxygen for survival, and they will be able to expect oxygen to give free radicals, but they also have a defense mechanism to defend against the dangerous free radicals. And how do they defend themselves? Because they have some important enzymes like these. Superoxide dismutase, which can take care of a superoxide and convert them into a non-dangerous water molecule and a OH minus. Okay, apart from that, you can also have peroxidase and catalase. Apart from that, you also have cytochrome reductase. Now, these four enzymes are the defenses against free radicals that they can happen. Now, if at all an organism has all the four of them, they are referred to as strict aerobes. If none of them are present, they are referred to as strict anaerobes. So, when it comes to Clostridia, Actinomycetes, Bacteroides, Fusobacterium, they are devoid of any of these enzymes. Now, who are the strict aerobes? Let me write it here. You have to know this also for clinical interpretation. Who are the strict aerobes? You have gram-positive strict aerobes and gram-negative strict aerobes. The gram-positive strict aerobe is Nocardia, which is a filamentous bacteria, and you have Bacillus. Bacillus anthracis is a strict aerobe. This is also a gram-positive organism. Among gram-negative organisms, Pseudomonas is a gram-negative strict aerobe. The cousin of Pseudomonas is Burkholderia. That is also a strict gram-negative. It's an aerobic strict organism. Here, these are simple examples. Now imagine, if at all I try to compare these two things, what are the clinical things I derive? I said strict anaerobes cannot tolerate oxygen. In your body, can you name a part of your body which is almost relatively anaerobic, and name a part of your body? See, Stardust, that's a very good question. When I go in a particular fashion, this is how I try to put it forward. That is, it can tolerate micromolar concentrations of oxygen. But tolerate does not mean it is just tolerating out of hate. It is actually wanting it. Philic means loving. It depends on low molecular concentrations of oxygen. But if you give them normal concentrations of oxygen, they will not be able to tolerate. So for you to remember that, I said it can tolerate micromolar concentrations. What happens if it is given a high amounts of concentration or normal oxygen concentration? They will actually face free radical injury. Whatever defense mechanisms they have will not be enough to handle the free radicals, because of which they can be killed. That is why we have to be very specifically understanding that they depend on low concentration of oxygen and they can tolerate low molecular concentrations of oxygen. Did you understand this? Yes. Now, what is the purpose of knowing this? I said aerobic organism. Tell me, which is the most aerobic organ of your body? Which is the aerobic viscera organ of your body? Can I ask you any more simpler question? No, lung. Stardust, it is the lung. Yes, it is the lung. So now if you trace the concepts backward, nocardia can be present as a commensal inside the airway. Bacillus anthracis is known for causing pulmonary anthrax. Pseudomonas is a very leading cause of lung infections. Burkholderia malae, Burkholderia pseudomalae, Burkholderia cepacia, all can have access towards lungs. So lung infections are very common because of strict aerobes. Now, there is one special organism that you should remember when we speak about strict aerobes. It is neither gram-positive nor gram-negative, but people consider them and put them under gram-positive organisms, but it is acid-fast. Now, who is the king of all acid-fast bacteria? Who is the king of all acid-fast bacteria? Come on, people. Who's the king of all acid-fast bacteria? Excellent. MTB is the king of all acid-fast bacteria. So you obviously believe that the primary route of entry of the MTB will be through the lung. Now you can ask a question. So what if the organism goes into anaerobic parts of your body? Will they be able to survive? Technically, they are not supposed to survive in anaerobic parts of your body. Like, who are the anaerobic parts? You told me the aerobic organ, right? What is that? You said lung. Who is the anaerobic part? It is GIT, gastrointestinal tract, or it can be the genitourinary tract. But you know, GIT tuberculosis also is known, genitourinary tract tuberculosis is also known. So tuberculosis is one organism which can affect every inch of your body. That is why it's a global threat all over the world. Now, when it comes to that area, this acid-fast bacteria will use different new virulence factors. Different virulence factors to survive unfavorable atmospheres. They can survive unfavorable atmosphere. That is why acid-fast bacteria like MTB is unique, and MTB is capable of using its nitrate reduction test positivity activity to go through this process. They can also have reducing property in some areas. Is lens also anaerobic? Lens is not technically anaerobic, but the oxygen supply to the lens happens by diffusion process, not through vascularity. That is why lens infection does not actually take place either by anaerobic organism or aerobic organism. Lens infection is very less common because lens does not have enough amount of nutrition for the bacteria to grow. Now, if I ask you, when it is a strict anaerobe, then where do they attack? The strict anaerobe will be attacking GIT or GUT. For example, Bacteroides is the most common anaerobic commensal of the human GIT. Please make a note of this. Bacteroides fragilis is the most common anaerobic commensal to be found in the human GIT. Then what about actinomycetes? Actinomycetes is also a commensal in the GIT, starting from the oral cavity till the anal canal. That is why when somebody punches you and that inflammation and trauma has not been set right properly, and if at all you have a lumpy jaw coming out of it, the most common organism would be actinomycetes. Now some people can ask me a question. So how can oral cavity be anaerobic? Oral cavity, I take air, the outer part of the oral cavity can actually have interaction with that of air. But look at the gingiva. The gingival crevices are anaerobic. In those areas and in the bony prominences in the jaw, those areas can be anaerobic because they are not having active oxygen entry and both out. If at all these jaw areas are getting oxygen, it is purely by blood supply, not by external interaction with that of air. So remember that whenever you focus on anaerobic infections, the lung infections will be slightly lesser. Now, can you name one anaerobic organism which can cause lung infection? Can you name one anaerobic organism which can cause lung infection? Bacteroides is capable of causing lung infection by lung abscess formation. Remember, lung abscess can be a property caused by anaerobic infections. Anaerobic infections, but they are forming abscess. Bacteroides is not capable of surviving the highly aerobic atmosphere of the lung. But how are they still capable of causing abscess? Because abscess is a walling off effect. Using the capsule of Bacteroides, you can produce an abscess wall area and the organism stays inside this particular abscess area. So the external force of oxygen will not be able to reach the organism. The organism is safe enough to cause anaerobic focus. Okay, now look at this. Give me an answer for this question. What is the answer for this question? Gonococcus differs from meningococcus and E. coli. Gonococcus differs from meningococcus, and then E. coli differs from Salmonella or Shigella on the basis of fermentation of which sugars? Excellent, Sadaf. You have actually improved by leaps and bounds. You have given a very wonderful answer. It has been a knock on the park answer. Wonderful. It is maltose and lactose. This is a simple way of looking at things. Now, let me tell you one thing. Whenever you have a confusion about glucose, don't think much about it. All organisms, all living organisms, even bacteria, will have glycolysis. The universal source of ATP for any organism will obviously be glucose. So glucose need not be considered to be a specific word to be said for any organism who's trying to ferment. Now, on that basis, you have to focus on a special sugar that should be taken. Now, gonococcus versus meningococcus is based on the maltose. Now, M for M, meningococcus is a maltose fermenting organism. At the same time, it is also a glucose fermenting organism. But gonococcus can only be a glucose fermenting organism. It is not a maltose fermenting organism. Point number one. Next, look at E. coli, Salmonella, Shigella. Now, what kind of questions can be raised from this area? Look at this. You speak of lactose fermentation vehemently. And lactose, if at all you have intestinal, if I am eating lactose containing food, the intestinal disaccharidases, will be able to break the lactose into glucose and galactose. galactose. Then glucose will enter into glycolysis. It can give you ATP. Then galactose will epimerize to glucose, and then it is again capable of entering into glycolysis. So energy can be produced. Now, what if a human being is having mutation in the GIT, because of which he is not able to have proper kind of lactase producing enzymes? So in case of lactase deficiency, the lactose accumulates, and that lactose goes into the colon. And in the colon, the lactose will be fermented by bacteria. Now, what is fermentation? Breaking down of any biochemical compound in anaerobic conditions. It is anaerobic breakdown. Anaerobic breakdown of any kind of compound, you call it as fermentation when it is supported by the formation of acid. Of course, you don't have any questions about it. Whenever fermentation happens, acids will be formed. But apart from the acid, gas can be formed. If the gas is an escaping kind of gas and purely permeable kind of gas, it is carbon dioxide. Remember, carbon dioxide is not capable of causing flatulence. Many people falsely believe that in the intestine, the carbon dioxide that is being formed is the reason for flatulence and the farting mechanism. But carbon dioxide is capable of permeating between the cells. In fact, carbon dioxide has high permeability compared to even oxygen. So carbon dioxide can easily escape through the cells. It won't accumulate inside the GI lumen to make you feel bloated. But instead, hydrogen will be the reason for the farting sensation. Hydrogen will be the reason for bloating sensation, and hydrogen will be the reason for having a bloated belly. Now remember, acid can be produced. At times, hydrogen can be produced, but acid is definite component of any kind of fermentation. Now on that process, you have bacteria who are capable of fermenting lactose, isn't it? Now who's a lactose fermenter? You all know E. coli is a lactose fermenter. And why is it so? Because E. coli has been a commensal over thousands and thousands of years since the human evolution has happened. Some of them have turned rogue. Most of the E. coli, that is 99.9% of E. coli you see all over the world, are non-dangerous commensal bacteria. Those E. coli who are capable of attacking the world over place is the pathogenic bacteria, which is not a huge proportion. It means E. coli by itself is a massive group of organisms capable of causing the most common cause of sepsis. Remember, E. coli is the most common cause of sepsis globally. Nobody can raise a question against it. E. coli is the most common cause of sepsis. If I try to draw a pictograph like this, you will be able to have a bar histogram where E. coli is the most common. The remaining organisms will be somewhere here. So it is unbeatable in number one position. So E. coli is the most common cause of sepsis. E. coli is the most common cause of UTI, and E. coli in the form of ETEC is the most common cause of traveler's diarrhea among bacteria. That means E. coli has multi-pronged approach towards attacking a human being. In spite of that, a very vast proportion of E. coli are commensals. They are pure saints. They are not willing to attack them. That is why inside the human body, E. coli is a commensal. But the same E. coli is capable of attacking the lung also. So now you tell me, are they strict aerobes or anaerobes? That is the question you should be answering by knowing one more thing. Who are the microaerophilic organisms? Can you name the microaerophilic organisms? The microaerophilic organisms, the best example will be Streptococcus pyogenes and most of the streptococci. Also, Campylobacter jejuni. Who is the brother of Campylobacter? Who's the brother of Campylobacter who's very famous for attacking your stomach? Campylobacter jejuni was initially referred to as Helicobacter jejuni. But some authors say this is not how it has originated. In fact, H. pylori is an organism who was initially referred to as Campylobacter pylori. How did they differ? Campylobacter has a seagull appearance. The organism looks like this with a long flagella. But Helicobacter is actually different. People thought it was Campylobacter pylori, but Helicobacter is different because it was able to have the helical structure. So this one is a folded organism or a rounded organism or a twisted organism with single folding, while Helicobacter has multiple folding to become helical in nature. At the same time, H. pylori is able to attack the pylorus of the stomach, while Campylobacter was known to attack the jejunus of the GI and jejunum of the GIT. So Campylobacter jejuni is microaerophilic. His brother Helicobacter pylori is also microaerophilic. Apart from that, you also have spirochetes like Treponema pallidum, which is also microaerophilic. So you can take the other spirochetes also having similarity with that of the microaerophilicity. So if you take the strict aerobes out of the equation, you take strict anaerobes out of the equation, and then microaerophilic organisms out of the equation, then all the remaining bacteria are somewhere in the facultative zone. Either they are facultative aerobic or facultative anaerobic. And what does facultative means? If the situation demands. So these organisms have tried their best to actually accommodate themselves in the growing, evolving field of the Earth's planet. The planet Earth was slowly from the anaerobic state towards aerobic state. When the planet Earth began its existence, it was anaerobic. It was filled with ether and that of carbon dioxide. Only after the evolution of algae and those photosynthetic organisms are able to accept the carbon dioxide and the liberated oxygen. For the first time, oxygen came into the atmosphere. So the atmosphere was contaminated. Before that, the oxygen was actually unavailable. But these organisms are initially in stages of evolution. The highly evolved organisms will be the strict aerobe. Can you name the most highly evolved strict aerobe? Can you name the most highly evolved strict aerobe? Can you name the most highly evolved strict aerobe? MTB is what you say. And MTB can survive for more than 5 minutes in the absence of oxygen. Who cannot survive in the absence of oxygen even for more than 3 minutes? It is the human being. Okay. Humans are the most strictest of aerobe ever noticeable. Okay, it's a googly question. Don't worry about it. Now, let's look at this. Now, look at this picture and tell me what you're seeing. In bacterial genetics, the picture demonstrated here is common in all the following organisms except. Now, the picture may not be very clearly seen from that angle. Now, have a look at this here. Read this picture carefully. Okay, what are we seeing here? See, when we have put 1 or 2 here, these zones are referred to as expression loci. In that locus in the gene, you will be able to see that gene present in the whole area getting expressed. Now, when something is present in 1 or 1 is present in the expression locus, that is 1 referred to the gene number. You also have 2 as the gene, 3 as the gene, 4 as the gene, N as the gene. Now, if 1 is present in that locus, that will give rise to mRNA, which gives you protein 1. Now, if at all the 2 is the gene which has progressed towards the expression locus, it has knocked off 1. Now, 2 is present in the position of 1. 2 has taken the place of 1. Now, that 2 is going for transcription to produce mRNA, which will translate to produce protein. Now, you have this is antigen 1, this is antigen 2. Now, look at this question. In bacterial genetics, this picture demonstrated here is common in all the following organisms except. What is your answer? See, to answer this question, you need 2 levels of understanding. I just want to see how many of you will be giving me an answer without much of a fuss. Then I'll tell you how exactly to approach this question. Tell me this. I just explained you the question. See, first thing I told you is how to understand this picture in the first place. First, you had expression locus 1. That is, gene 1 was present in the expression locus. Then gene 2 went and sat in the expression locus. So 1 was knocked off. When 1 gene was actually present in the expression locus, that gene's mRNA came out and that gave you the protein 1, which was antigen 1. Now, when the same position, but gene 2 has come. Now, gene 2's mRNA is produced, from which the protein 2 is produced. Now, the protein 2 is antigen 2. What is the answer here? Try. Just give me some answer. No, not trypanosomes. Okay, I'll explain the answer here. Now, this particular activity, whatever you saw in this picture, has a name that is called as programmed rearrangement. Programmed rearrangement is what you saw in this picture. See, molecular biology is the future. Many questions can actually evolve from both biochemistry and that of microbiology, even in case of pharmacology, in the form of molecular biology. Recombinant DNA technology, etc., also are important. You have to know these kind of questions. That is why futuristic questions like this have been added now, and try to implement that into a conceptual question. You should be able to crack any kind of question easily. Now, what I showed you here was the gene 1 came to the expression locus that was expressed as protein 1, which is antigen 1. Now, when it was actually taken back, now 2 gene was placed in the same expression locus. The protein 2 has come into existence. So now instead of antigen 1, an organism is showing antigen 2. The same organism initially was expressing antigen 1. Now it is expressing antigen 2. What does it mean? It is showing antigenic variation. Now, antigenic variation happens by many mechanisms. It can be by mutation, it can be by alteration, it can happen in any mechanism. Now, here, this is a genetic condition where programmed reengineering or programmed recombination is happening, and that is capable of giving you variation in antigenicity. Now, this is a property of gonococcus. That is why gonococcus has become multi-drug resistant sooner. It is property of Borrelia recurrentis. Borrelia recurrentis is known for causing relapsing fever. Trypanosomes, which are capable of evading host immune defenses. But the only organism who does not show much of variation, who is still responding to penicillin. See, generally, many kind of organisms have become drug resistant to penicillin. Penicillin is out of the vogue almost in most of the conditions. But Streptococcus is one condition who is like an old school romantic lover. It is Streptococcus is like an old school romantic lover who does not have much of antigenic variation at all. It has been the same. So it is still responding to penicillin. Can anybody give me those organisms' name which are still responding to penicillin? Can you name a few organisms who are still responding to penicillin? The organisms who are still responding to penicillins are Streptococcus pyogenes. Never make a mistake of calling it as Staphylococcus aureus. Staphylococcus aureus became drug resistant even before people started understanding about drug resistant towards penicillin. Okay, Streptococcus pyogenes is still responding to penicillin. One important technique by which you can differentiate between two species of a genus is penicillin sensitivity in case of Bacillus. While Bacillus anthracis is still responding to penicillin, Bacillus cereus and other kinds of organisms are not responding to penicillin. Excellent stardust, Treponema pallidum still responds to penicillin. Now, whoever gives me one more answer will receive a gift from me. Whoever is capable of giving me one more answer, one more organism who responds to penicillin will receive a gift from me in the next 10 seconds. Okay, the time is up. The answer is Clostridium. Please take a note of this. Clostridia can also respond to penicillin. But penicillin is not the drug of choice. People have moved towards cephalosporins and other cell wall synthesis inhibitors. But these four organisms are still loyal and they are responding to penicillin. Again, I'll repeat, Pyogenes, Anthracis, Pallidum, and Clostridia. Okay, now let's look forward. See, Nocardia, you should try with sulfa drugs more than that of penicillin. Actinomycetes can respond to penicillin. Okay, now look at this. Nocardia is for sulfa drugs, and actinomycetes may respond to penicillin, but people have now gone for cephalosporins. So we can add actinomycetes also into this area. One of the most important differences in treatment in case of mycetoma. See, mycetoma can be of two types: eumycetoma, actinomycetoma. Eumycetoma means true mycetoma? No. I repeat, the word eu may speak about true. When I say eumycetoma, it does not mean we are speaking about true mycetoma. If I say eumycetoma means true mycetoma, then actinomycetoma is a false mycetoma, right? No. Eumycetoma means the mycetoma that is caused by a true fungus. If a true fungus causes mycetoma, it is called as eumycetoma, while a false fungus, like a bacteria who's causing mycetoma, that is called as actinomycetoma. Now, why do you call them as false fungus? Why don't you call them as true bacteria? Why are you calling them as false fungus? Because there is an organism called as Allascheria boydii. There is an organism called as Pseudo-Allascheria boydii. Now, Pseudo-Allascheria boydii is a false bacteria. But Alascheria body is a true bacteria that makes Pseudo-Alascheria body a true fungus. So when it is capable of attacking you, you are attacked by a true fungus. That mycetoma is eumycetoma. This is where the confusion started. So remember, eumycetoma is caused by true fungus, while actomycetoma is caused by a false fungus, but it is by a true bacteria most commonly. But mycetoma is true. The concept of mycetoma is true. But remember this, in this area, if at all you think of it as actinomycetoma, there are two organisms who are consistently known for causing actinomycetoma. Actinomycetoma can be caused by, on one side, actinomycetes, on the other side, nocardia also. Now, how will you differentiate them in terms of treatment? First, you have to investigate and find them which one is which. Actinomycetes, nocardia. I'm sorry. Actinomycetes and nocardia, both of them are gram positive. Both of them are filamentous bacteria. They don't have a proper shape as such. Both of them are filamentous and both of them are gram positive. How do you differentiate them? By going for acid-fast staining. Now, who is an acid-fast bacillus here? Nocardia is partially acid-fast up to 1% sulfuric acid, while Actinomycetes is not acid-fast. And why should you do this investigation? Only when you do this investigation and find out that nocardia is acid fast negative, I mean it is acid fast, and actinomycetes is not acid fast, you will be able to start the treatment. Why? Because for actinomycetes, penicillin and cephalosporins can still be the treatment of choice, but for nocardia, sulfa drugs will be the treatment of choice. So know this very clearly. Did I make myself clear? Sudhaf? Others? See, generally it is not very easy for you to keep listening to a teacher continuously. So you can ask me a question. For the next 2 minutes, I'll be quiet. You ask me any questions that you have in your mind. Anything for that matter. Anything that is bothering you in the field of medicine or in the field of microbiology to be specific, or any other question. Hello, Sundari. Good evening, Sundari. Any questions about your preparations or about life in general? Anything that is bothering you from giving your best? Any topic specific questions? Take 1 more minute and ask me if you have any questions. I know, because continuously listening to a voice is not very easy. It's an honor to teach you also, Sadaf. It's an honor to teach you, Sadaf. Thank you very much. How to study genetics in biochem? See, you all can download the app Manipal Medace. In that, for 3 days, you will be having unlimited free access. You can just check out any of the videos from there, and there, if at all you want, you can download this app and try to listen to genetics completely. You will be able to answer almost all questions from genetics if you listen to this class. But when you start genetics, first you have to understand, if you're not going to download this app, that is also fine. I'm just giving you an advice in such a way. Download it for 3 days. You can actually visualize it free. Yes, RDNA technology, RFLP, I have discussed all of them in the app, and I have done it in 1.5 hours. All the molecular biology techniques I've done in 1.5 hours, and the whole of genetics has taken around 7 to 8 hours of finishing it. You can go through it if you have time. For 3 days, definitely you can find in that. But the point is, first you start with the nucleic acid chemistry. Read about the nucleic acid chemistry, like everything from starting from adenine, guanine, thymine, cytosine, uracil. Then try to see who is what and how uracil becomes thymine, etc. Then look for RNA formation, DNA formation. Then look at RNA and DNA replication. Then go for transcription and translation. Then you go for the newer developments that you have seen. For example, CRISPR concepts, mRNA editing techniques, and you have post-transcriptional modification, post-translational modification. Then you go for the molecular biology techniques. It will be easier for you. Yes. Sir, how important is mycology for INI-CET? Oh my God, Aditya, remember this question and remember this answer. I'll give you a simple example. In the year 2009 and 2010, I took my first AIPGME exam, All India Postgraduate Medical Entrance Exam. Out of the 300 questions that I had, 2 questions came from mycology. People were surprised, they were shocked. 2 questions. 2 questions. How can you actually ask 2 questions from mycology is what they said. Because from 2001 to 2009, in every exam, either you'll get 1 question or you'll get 0 questions from mycology. Because mycology was a very small subject, because in case of your microbiology textbook, there were only 7 to 8 pages dedicated to mycology. Now, do you remember how many pages that the SARS-CoV-2 had before COVID-19 pandemic became very famous? Do you know how many? Yes, Sadaf Namin. Happy Iftar, happy Ramzan. Can you guess? Can you guess how many pages were dedicated to SARS-CoV-2? In most of the textbook, coronaviruses were given only one paragraph. Out of one paragraph, people did not actually think of it as an important thing. People just kept on doing it. Why? Because coronavirus will cause clinical features similar to that of your common cold only. So you don't have to read much about it, is what even every senior was telling the junior also. Many teachers also said the same thing, but only after the lockdown came into existence, the pandemic actually blew everyone's life away. That is when people realized that SARS-CoV-2 was very, very dangerous. Now, advent of HIV/AIDS and rapid utilization of corticosteroids to suppress any kind of storm. For example, in SARS-CoV-2, to suppress the cytokine storm and to save people, high-dose methylprednisolone was given. In all these conditions, the mycology became more and more important. See, not many people knew about mucormycosis, but mucormycosis became very important after the SARS-CoV-2 because people were actually put on high-dose methylprednisolone and were taking industrial-grade oxygen cylinders. So suddenly mucormycosis became deadlier. So whenever the HIV/AIDS prevalence and immunosuppressive regimen is increasing, chemotherapeutic use has been increasing, even antibiotic abuse has happened, in all those areas fungal infections can become dangerous. Now in major textbooks, fungi chapter are getting approximately 30 to 40 pages. Now you can expect 4 to 5 questions from the 30 to 40 pages. Now let me give you a calculation. See, if you read from a common textbook where bacteriology has approximately 600 pages, virology has 300 pages, and parasitology has 200 to 300 pages. Now, immunology has around 100 to 150 pages. In all those areas, if you look at bacteriology questions, you may get, for example, of the 30 questions, bacteriology will contain 50 into 16 questions. And here you may get around 4 questions. Here you may get 4 questions. Here you may get 2 questions. And then in mycology, you used to get 1 question. Now, look at this. Mycology initially had only 4 to 10 pages, out of which 0 or 1 question comes. Now you just have to read 30 to 40 pages, and in 2019, 20 and 21 you had 4 MCQs. Now you have 5 to 10 MCQs coming from mycology, especially after sporotrichosis becoming very famous. Sporotrichosis was repeatedly asked in JIPMER, AIMS, PJ Chandigarh, INI-CET and NEET exams. And all the exams, sporotrichosis was a regular contender. Now in the last 2 years, sporotrichosis is slightly replaced by chromoblastomycosis. That is also very famous. Candida is also very famous. These organisms are right now very famous for MCQs. You can solidly expect 5 to 10 questions. Sometimes they may actually surprise you by not asking 5 to 10 questions. At least you can expect 4 questions. So mycology is a must-know subject for the whole of your exam, not just for microbiology. For your whole exam, mycology is important. Did I give your answer, Aditya? Let me show you one picture. I'm just live here and I'm just showing you this. Do you know this particular vehicle? Have you come across this vehicle? It is Bugatti Chiron. It is Bugatti Chiron. And this is one of my most favorite car ever in the planet. People ask you, what is your dream car? Why do they use the word dream car? Because you dream of owning it one or buying it one at some point of time. I'm pretty sure I won't be buying this car because I don't think as a doctor you will be able to earn that much amount of money to buy a car, and even if you have that much money you will not be spending it on such kind of car. But this is one of my all-time favorite, not because of the luxury it offers, not because of the features it has, but merely because it gives you some kind of goal in life. The goal is not about buying it. Let me tell you this. When I ask you, what is the difference between competitive spirit and jealousy? What is the difference between competitive spirit and jealousy or envy? If, for example, one fellow is studying in the hostel room, now other fellow is looking at him and then he also starts studying. Now, this studying part can be taken as either competitive spirit or jealousy spirit. Which one is actually the right answer? It can be taken in both. But how will you differentiate whether the second person is reading the same book out of competitive spirit or jealous spirit? Let me explain it in a very simple fashion. When a person is competitive, you respect your competition and you try to see that you want to beat your competitor when your competitor is at the top of his game. I repeat, if A and B are competing with each other, B respects A and he'll encourage A to do better. And while A is doing at the top of his game, B wants to beat him at the top of A's game. Now that is called as competition. Now what is jealousy? If A and B are competing for the same thing, but instead of competitive spirit, B tries to put A down in such a way B feels that he is better than A. Now in this process, when a competition is actually healthy, this B is trying to be on his heels. So A will start running faster and faster, and B is trying to push him to his extreme, and then B beats him. At this point of time, B may win or may not win, but A is also better than what he was previously. B is also better than what he was previously. But in this position, A has lost his ground, and B is not actually improving himself. Both of them have brought down the quality of work. That is called as jealousy. Now I showed you the car, right? My favorite car is Bugatti Chiron of all time. Whenever I go on long drives with my brother, I'll ask my brother to read some important information or any fancy information all over the place. One day we'll be reading about the top 100 banks in the world. Out of the top 100 banks in the world, the one bank that comes in the top 100 banks is SBI in India. We feel proud. Who's the top bank? Can anybody guess? Who is the top bank in the world? It is a bank from the government's primary bank, Central Bank of China. Now, you keep on reading something new. How many states are there in USA? Likewise, once I was trying to read what is the BHP, brake horsepower of certain cars. And I have a small simple car. My car's brake horsepower is 69 bhp. I was like, wow, 69 bhp, brake horsepowers. 69 brake horsepowers, it means 17 brake horsepowers approximately will have the power of an actual horse. An actual horse's power is 17 bhp. So imagine 69 bhp means approximately 4 to 5 horses are pulling me. That is what I was feeling proud about. Then I was seeing what is the most powerful car? What is the most powerful car? BMW's most powerful car somewhere is around 680. And I was thinking of a Maruti Suzuki car. It has a BHP of around 17 or 18. I mean, 70 or 80. Then it comes around 100. And when I went for what is this car? It's Hyundai. In Hyundai, there was a car which was for 110. Verna was 110 bhp. So they were advertising as the power of more than 100 horses. And I was trying to see what was about Ferrari and what is about Lamborghini. Ferrari came around 700, Lamborghini came around 800. Then I came for Bugatti Veyron. The Veyron was actually famous 7 years back or 11 years back. Bugatti Veyron. I was not able to find the BHP anywhere. On careful searching, I realized I was missing the BHP because it was written in just two numbers. It was written as 1.3K. What is 1.3K? 1300 bhps. And now Bugatti Chiron, which I showed you, is coming around 1600 bhp. It is actually beating all the other competition by a margin. Now, if at all you played Need for Speed or any kind of game like Asphalt, in Need for Speed, you'll be pulling in all the different kinds of cars. The ultimate car you'll unlock would be Bugatti Veyron. Now, it will be coming as whenever you reach the last step, it shows Bugatti Veyron. Leash, unleash, S, no, S, no. When you click S for unleashing Bugatti Veyron, it hits every other competition by a huge margin. The particular CC of that car will actually be 8000 cc with a 16 valve cylinder. It is capable of beating everybody by a margin because the capacity of the car is so huge. Now, all the other cars have to dream to beat such a kind of car. Whenever you improve your capacity, you're so powerfully confident that everything else appears very rosy for you. When you're not very well prepared, everything else will give you some kind of jitters. Everything will scare you. But once you actually have a Bugatti Veyron in a car or Bugatti Chiron in a car, you'll beat the competition by a margin. Nobody can actually come near you. If I take 10 Indian cars of Indian make around some 1000 cc or 2000 cc, etc. I keep 8 of them parallelly or serially, they'll never be able to reach the same kind of power. But Bugatti Veyron or Chiron comes around 1600 bhp, which can beat a competition with a high speed of more than 420 kilometers per hour. Then that is the car to beat. Now that is what you have to know in case of competition. Now when I'm going on a BMW car at a speed of 200, 250 kmph in India, it's not actually generally possible. But imagine I'm riding at 250 kmph and I'm feeling very royal about myself. But suddenly a Bugatti Veyron crosses at a speed of 450 kmph, then you'll feel so small about it. Now, what is exactly competition and jealousy here? If at all you want to become big enough to buy a Bugatti Veyron, or you want to race the Bugatti Veyron and hit the Bugatti Veyron and cross it, that is called as competition. But instead, you start praying that Bugatti Veyron goes and hits a tree and the person, driver and the car both are getting crashed. That is called as jealousy. This is the time at which you should be able to understand whether what you actually grow inside your heart is competition or jealousy. Raise the competition level, feed the competitive spirit in your mind, try to beat everybody at the top of their game. That is when you become great. Okay, Aditya, are PYQs alone enough to fetch a decent score and rank in NEET? What's your advice for post-intern? If you're a fresh intern, when you don't have enough amount of time, please do all the PYQs as much as possible. Beat all the PYQs by reading the answers. Look at this. Now, if you have 100 days time before any kind of exam, out of 100 days, keep around 5 hours of learning. Not about 5 hours of reading, 5 hours of learning. Imagine if I keep my book here and I keep reading this, sometimes my mind will be wandering. After reading for 1 hour, I'll realize for 20 minutes I was actually thinking something else. It means for 40 minutes only I was learning. So if I'm able to learn 5 hours in a day for 100 days, I'll be having 500 hours at my disposal. Now, you might have gone for any coaching institute, you might be having an app, whatever you have, they're all resources for you to give you information. But solving PYQs will make a huge difference. Out of 5 hours a day, spend 3 hours in solving PYQs. Solve 1 hour in solving MCQs of a newer nature and 1 hour in reading the explanation of all of them, along with that of the theory related to this. Now, every 10 days once, after doing 50 hours of reading, try to spend 5 hours in revising whatever you read for 50 hours. Now, do it consistently. When you have 500 hours, keep 100 hours for revision and 400 hours for reading first the PYQs and then the regular MCQs. And when you go for the exam, I'm pretty sure you'll get a good rank. That is what I can say. But if at all you're going for INI-CET and NEET, if you want to have a short rank with the mark sheet, then make sure that you spend approximately 1,000 hours before you go for exam. To confirm your seat, you should be preparing for 1,000 hours, minimum 1,000 hours. And out 1,000 hours, spend 500 hours on MCQs and 500 hours on the theory, along with revision and that of practice. This is for the primary reading, and then back it up by 20% of this hours for revision. You should be able to get a good rank. Is it okay, Aditya? Advice for third year students on next. See, whatever you have learned till now, the next exam has become very specific. Now they're focusing on clinical subjects to be beginning with, and the non-clinical subjects are supposed to support the clinical questions. Now, no clinical question can be answered without the basis for the non-clinical topic. For example, if they pick out a pediatrics case and they say inborn error of metabolism in the form of Gaucher's disease, when you try to focus only on pediatrics and you learn Gaucher's disease is because of beta glucocerebrosidase, you just have to keep on mugging up the clinical features, if at all they are just clinical symptoms. But if you learn about the Gaucher's disease from the bottom up using biochemistry, spend 20% of the time in learning about the biochemical aspect of it, and then remaining 60% in reading the clinical aspect of it, and then 20% in solving the MCQs belonging to both of them. So whenever you read a clinical case, try to go back to the absolute basics. If you're going for the surgical side, read the anatomy and the physiology of these muscles or the organs or any kind of the structure that you're seeing, and spend 20% of the total time on them, and then spend 60% of the clinical thing about the surgery or medicine or OG or pediatrics. After that, you go for 20% of time spent on the MCQs. If you keep on doing this, you will be a master of the situation. Any next exam question will be easier for you. But for the third year student, my humble advice is go for MCQs, and out of the MCQs, make sure more than 50% of MCQs are clinical questions that you're trying to solve. Is that okay, Mukunda? So now I'll come back to this question here. In this question, in simple words, I'll tell you, this picture is about programmed rearrangements. So what you say, at a later time, a copy of gene 2 is made and inserted into the expression locus. By moving only the copy of the gene, the cell always keeps the original DNA for use in the future. Whenever programmed rearrangements happen, the original DNA will be kept intact. A new kind of gene will be occupying the expression locus. Expression locus situation alone changes, so the information can change. So antigenic variation can be seen in gonococcus, Borrelia recurrentis, trypanosoma, but not in streptococci. This is the concept of this question. Let's go to the next question. Try to answer this. Hello, Pulse Physician. Thank you very much for giving me this answer. You're saying B. Any other answer? Any other answer? Aithya says staph. Okay. Aithya, can you tell me why you chose staph? With this one question, I'll tell you a lot of concepts to answer using respiratory tract infections. Just tell me why you chose staph. And pulse physician, can you tell me why you chose chlamydia? All right, while you keep thinking about it, let me tell you a few concepts. Now, what are the most important things you have to remember? Number one was high grade fever. This is very important. The word high in the grade fever is very important. Next is respiratory distress. Whenever a patient has high grade fever and respiratory distress, what do you think of? When you think of respiratory distress and high grade fever, what do you think of? What can be the very common, simple diagnosis? When you think of high grade fever plus respiratory distress, what is a simple diagnosis? Epidermis causing skin infection, so same family. Yeah? Why do you speak of skin infection right now? Because you're focusing on lung infection. Okay, pulse physician, very good answer. So think of pneumonia. Now, if I say this combination is for pneumonia, I'll write another combination. Headache, neck rigidity, and high grade fever. This is a triad for what diagnosis? Anybody? MTB causes an immunosuppressor? No. Even in immunocompetent people, MTB is capable of destroying them into pieces. Yes, very good pulse physician. This is meningitis. Very good. Now you have two answers with you. One is high grade fever, respiratory distress giving you pneumonia. The other one is high grade fever, headache, neck rigidity giving you meningitis. In both the conditions, what is common? High grade fever. And if it is high grade fever, think of it as pyogenic. Now, when it is pyogenic in nature, this pneumonia is referred to as typical pneumonia. And this meningitis is referred to as typical meningitis, but this is not a very famous kind of term. Instead, pyogenic meningitis or bacterial meningitis is the term. Now, these are very important for investigations and diagnostics. Inspiring lines, very good. Can you please tell me your name? What is your name in inspiring lines? All these are very good names. They are very inspiring. Okay, now look at this. Whenever you have high grade fever, it speaks about the formation of a pus. And pus can actually be seen in the case? Yes, because the case is already having the name pus in it. Now, respiratory distress, high grade fever, pus speak about pyogenic pneumonia. If it is not treated or if it can become worse, it can become empyema thoracis. Empyema thoracis. And out of the four options given, the only organism capable of producing pus is Staph aureus. Why? Because MTB, chlamydia pneumonia, Legionella pneumophila, all of them are known for causing atypical infections. What are you speaking about? Why are you speaking about atypical, typical? What does it mean? It's very allergic, is what many brains will be thinking in the exam hall whenever I speak about typical or atypical. Purulent pus staph infection. Yes, that is what I'm saying. Correct. Now, let me tell you a very simple thing. What is pus? Venke. Okay. Pus is equal to dead neutrophils. This is the most important thing you have to know. Dead neutrophils plus or minus. Plus or minus means whatever I'm going to write next may be present, may not be present, which is live neutrophils. But dead neutrophils should be present. Plus dead or alive bacteria. Now this bacteria should be present, but that can be present as dead or alive. Neutrophil should be present only as dead, and only dead neutrophils are capable of being called as pus. Live neutrophils may be present, may not be present. That doesn't matter. But a bacteria should be present either dead or alive. Catch them dead or alive, they say, right? Along with that bacteria, you have to take two more organisms, Aspergillus and Candida, which are fungi, plus the plasma component, plus the protein components. Here the proteins are most probably antibodies. Now all these put together is referred to as pus. Now whenever you have dead neutrophils, you can have pus. If I knock off the dead neutrophils, whatever these are present as live neutrophils, dead or alive bacteria, Aspergillus, Candida, plasma, protein. None of them will make any sense if the dead neutrophils are not present. So any organism who's capable of causing pus should primarily be able to kill the neutrophil. Are you following this part? Now, what kind of immune system is neutrophil? Neutrophil will be extracellular immunity. Neutrophil will always be tackling extracellular immunity. Extracellular immunity would mean what? Extracellular immunity is actually basically the humoral immune response. Humoral immune response would mean to say, whenever you have humoral immune response, hello Dr. Abhiram, thank you very much. Thank you for joining the session. How are you doing? Okay, so now when you have humoral immunity, the humoral immunity will be made up of neutrophils, then antibodies, plus complement factors. Now, the neutrophils plus antibody plus complement factors are actually capable of fighting the organism. Now, where the organism should be found? You tell me. If the neutrophil, antibody, and complement, all three are supposed to attack the organism, where should that organism be found? Most avoided session. What a honor, Abhiramiji. Thank you, Abhiramiji. Next, I'll also come and see your sessions more and more. Thank you very much for doing your session also, Abhirami. Yes, they'll be found in the ECF. So these organisms are found in the extracellular fluid. It means these organisms are mostly extracellular organisms. These are extracellular bacteria. Very good, Mukundan. Mostly in the blood, but they can also be found in the plasma and serum, which are components of blood. Apart from that, they can be found in the CSF. They can be found in the pleural fluid, peritoneal fluid, all these kind of fluids, which are actually fluid. Humoral immunity means the immunity that is floating in the fluid. What is the fluid? Humor means fluid. Fluid means either it can be liquid or gas. So the liquid component of the immune system is the blood, most common thing, or ECF. So if an organism is actually present in the ECF, then only they'll be dealt with by antibodies and complement factors and neutrophils. Are you getting this point? Now, more than this, you have to ask yourself, if you keep saying intracellular and intracellular, intracellular organisms are dealt by what? Intracellular organisms are not meant as dealt by. Intra-organisms are formed by swallowing of the organism by a cell called as macrophage. So, macrophage, when it tries to crawl near the organism, if the organism is here, it keeps on crawling and then it captures it. So if a microbe is actually captured by the macrophage, it has been swallowed. Swallowed is called as phagy. And if the organism is big, it is macro. So a macrophage is a big swallower. A big swallower is a macrophage. Whenever there is somebody called as big swallower, there should be a small swallower. Who is the small swallower? It is a microphage. Have you heard of a word called as microphage? A microphage is nobody else other than a neutrophil. Now, if at all a neutrophil is allowed to attack an organism, either it throws the dangerous granulozymes and destroy the organism, or it tries to swallow very small organisms and try to digest them inside. But if a neutrophil is trying to attack an organism, the organism is primarily found in the ECF. But a macrophage, once it swallows the organism itself becomes intracellular. That is the gold standard thing that you have to understand. Excellent, inspiring lines. They are present inside the macrophages. So any organism is captured by macrophage will actually present itself as atypical organism, which are intracellular organism. Now that brings us to the question, which organisms are intracellular inside the body? Those intracellular organisms, if they are captured by the macrophage, the neutrophils will not be able to come and attack them because the macrophages are already ingesting them. So if macrophages are saying, hey dude, I'll take care of the organism, you take care of thing, then the neutrophils will say, yes boss, I will not attack you, and the neutrophils will go away. Neutrophils will actually go away. The macrophage will try to take the organism is inside the macrophage. So now, because the organism is carried by the macrophage, neutrophils will have no role to play here. So neutrophils will not come and fight. If the neutrophils don't fight, neutrophils cannot kill, and neutrophils cannot be killed. If neutrophils don't die, what is not formed? If neutrophils can't reach the organism, they can't fight the organism, they are not killed by the organism, what is not formed? Pus is not formed. Excellent. Pus is not formed. So if an organism is intracellular, pus is not formed. Now, what is the beauty of a pus? Pus means it contains dead neutrophils, I told you, right? It contains dead neutrophils plus dead or alive bacteria plus the Aspergillus candida, plasma protein, etc. When the pus is formed, it is because of the dead membrane of the neutrophil. At that point of time, you realize one thing: the dead membrane of a neutrophil is a very strong pyrogen. Pyrogen means generating pyrexia. It means they are capable of going through the blood to the hypothalamus, and they'll reset the hypothalamic thermostat mechanism to a higher temperature. They'll increase the core body temperature. That is why you have high grade fever easily touching 39.5 to 40.5 degrees Celsius. So high grade fever comes because of the activation of the activation of your hypothalamic thermostat mechanism through the pyrogens, and pyrogens come because of dead membrane. Dead membrane is because of the death of the neutrophil. Can you name any other cell whose dead membrane also is capable of acting as a pyrogen? Brucella, MTB, Chlamydia, Legionella, viruses, excellent, inspiring lines. These are all intracellular organisms. Very good. My question is something else. I'm asking you, which other cell whose membrane, if it bursts open, can also give you high-grade fever? Anybody? Which other cell whose membrane is dead along with the particular cell can cause high-grade fever as a pyrogen? The answer is an RBC. And massive RBC lysis happening every 2 days once, or every 3 days once, or every 4 days once is a property of, hello Sankri Ganesan, you came close, but that is not what I'm expecting. Echinococcus is a parasite. I'm asking you about a cell inside the body, cell. RBC, can you tell me massive hemolysis happens in this infection every 2 days once, or every 3 days once, or every 4 days once? Excellent. Malaria. Very good, Mukundan. In malaria, you will be able to have RBC hemolysis, that is hemolysis happening, and a massive number of RBCs are broken down during quaternion, tertian malaria, etc. And every single periodic area, when massive release of the RBC membrane happens, the RBC dead membrane is also a strong pyrogen. That is why in case of malaria, you have high grade fever, so high it is also capable of causing chills and rigor. So remember, either you have a pyogenic infection caused by bacteria or by malaria and babesiosis where you'll have high grade fever. Now, when I speak about pyogenic infections, look at this part. As our inspiring lines correctly said, we have to focus on the intracellular organisms. Who are the most common intracellular bacteria? The header organism is MTB, Mycobacterium tuberculosis. Because it is intracellular and because it is not capable of attracting the neutrophils, neutrophils will not come to the fight. If neutrophils don't come to the fight, neutrophils don't die. If neutrophils don't die, you won't have high-grade fever. That is why in tuberculosis, you'll never hear the word high-grade fever. It is always a low-grade fever. But you don't call it as a low-grade fever, do you? In case of tuberculosis, you call it as evening rise of temperature. Why do you call it as evening rise of temperature? Throughout the day, from 4 a.m. to 4 p.m. or up to 12 a.m. in the night, throughout the day, you'll have a low-grade fever only. But why do you call it as evening rise of temperature? Between the 4 a.m. and 4 p.m. that you see every day, by 4 a.m., there is an increase in the glucocorticoid release. And these glucocorticoid release has to happen in a pulsatile fashion every day in the morning. Now, if he's a person working as a daytime person, not a night duty person, for a person who works in the daytime, by 4 a.m., glucocorticoid release will happen. And glucocorticoids in high doses can act as an inflammatory or anti-inflammatory agent. See, these are the proper inflammatory drugs. These are the proper anti-inflammatory agents. I'm so sorry. These are the proper anti-inflammatory agents. The most powerful anti-inflammatory agents can be glucocorticoids because they can suppress the formation of any inflammatory agents. Only then came aspirin, which is a non-steroidal anti-inflammatory drug. So steroids are the most powerful anti-inflammatory agents. So between 4 a.m. to 4 p.m., the natural endogenous glucocorticoid formation is good enough to suppress the symptoms of the temperature throughout the day. But by 4 p.m. when the glucocorticoids will start falling, now the low-grade fever will start showing. That is why you have evening rise of temperature. It is so low, so you have to understand MTB is atypical. It can't give you very high-grade temperature or high-grade fever. It causes low-grade fever, but the better to say is evening rise of temperature. Now, the same thing can be seen or similar things can be seen in other organisms which are intracellular, which are not dealt by neutrophils, but they're already captured by the macrophage. After MTB, you have mycoplasma, you have spirochetes, you have chlamydia, rickettsia. Rickettsia has a variant called as Ehrlichia, and you have Legionella. 1, 2, 3, 4, 5, 6. Now, there is one more organism. Can anybody tell me one more organism who can actually be coming under atypical nature? As you said, Brucella is possible, but no, we are speaking about bacteria only, pulse physician. Brucella is possible, but Brucella is not a proper atypical organism or typical organism. It comes between both. It causes pyrexia of unknown origin, understandable. So these organisms are all atypical organisms, no pus and no high-grade fever. Now coming back to the question. Look at the question here. Now read the question once again. You are able to understand that there is pus and you're able to understand there is high-grade fever, respiratory distress. So it is not an atypical infection, it's a typical pneumonia. And out of these organisms, MTB is atypical, chlamydia is atypical, Legionella is atypical, Staph aureus is the king of all typical organisms. Who's the king of all atypical organisms? MTB. Who's the king of all typical organisms? One is Staph on the side of gram-positive, and the queen is on gram-negative side, it is E. coli. E. coli on one side, Staph on the other side. And please remember, the most common cause of bronchopneumonia is Staph aureus. The most common cause of bronchopneumonia is Staph aureus, and the most common cause of lobar pneumonia is pneumococcus. These are all important MCQ, never forget them. The most common cause of bronchopneumonia is Staph aureus. The most common cause of lobar pneumonia is pneumococcus. Okay, so the answer is staphylococcus here. Shall I ask you a question? From what I've taught you till now, shall I ask you a question? Just use whatever I told you and give me an answer. Okay, tell me, what is the most common pneumonia caused by Staphylococcus aureus? What is the most common pneumonia caused by Staph aureus? Come on, people. I just now taught you. Pulse physician says bronchopneumonia. Aditya says bronchopneumonia. Any other answer? Any other answer? Now let me tell you a very famous story from anatomy. Once an anatomy teacher was teaching his table students, and he said, I expect proper loyalty and proper obedience from all of you. Now do as I do. Whatever I do, I want you to copy down. Okay. And he put one of his fingers, that is, he took his index finger and put it into the cadaver, and then he tried to put his finger into his mouth. He tried to put his finger into his mouth. All the students were disgusted. All of them were disgusted, but he has told that you have to be perfectly obedient. You can't actually be disobedient. So all of them put their fingers and they put their mouth and they all did that. But one fellow was actually completely cool. And he said, are you not disgusted? Did you not put it in your mouth? I saw you put in your mouth. Then why are you not disgusted? Because the liquids of the cadaver came into your mouth. He said, sir, I noticed you very well. What did you notice? He said, sir, you put the index finger into the cadaver and then you put your middle finger into your mouth. I saw that. That is why I also did it. Then he said, you have observed very clearly. That is why your obedience actually is not a big concern. Your observation skill is more important. Other people were obedient, but they were not very observant. Now, when I asked you this question, you made the same mistake. Now, what did I tell you? Look at this. I said the most common cause of bronchopneumonia is Staph aureus. The most common cause of lobar pneumonia is pneumococcus. Okay. The most common cause of bronchopneumonia is Staph aureus. The most common cause of lobar pneumonia is pneumococcus. Let me repeat. The most common cause of bronchopneumonia is Staph aureus. But did I ask you that question? I asked you, what is the most common pneumonia caused by Staph aureus? What did I teach you? The most common cause of bronchopneumonia was Staph aureus. Now, why is this question important? Staph aureus is capable of causing both bronchopneumonia and lobar pneumonia, but the number of cases of lobar pneumonia caused by Staph aureus is definitely more than the bronchopneumonia cases. So, the most common pneumonia caused by Staph aureus is lobar pneumonia. But now look at the number of bronchopneumonia cases. For example, if I have bronchopneumonia cases of approximately 1000, I'll have lobar pneumonia cases of approximately 10,000. That is the approximate ratio. Broncho pneumonia is 1000 cases. Lobar pneumonia can be 10,000 cases. Now, when I ask you who's the most common cause of lobar pneumonia, the answer is pneumococcus, right? Pneumococcus will actually take up 5,000 cases in the whole, 5,000 to 6,000 cases. But if I ask you how many lobar pneumonia cases were caused by Staph aureus, the answer will be approximately 1,500 to 2,000 cases in a general community. But what is the total number of bronchopneumonia cases? 1,000. Now, who is the most common cause of bronchopneumonia? Staph aureus. Even though Staph aureus is the most common cause, it can contribute to 600 to 700 causes of bronchopneumonia. Now take the raw data. Among lobar pneumonia, Staph aureus contributed to 2,000 approximate cases of lobar pneumonia, while it was able to cause a maximum of 700 bronchopneumonia. Lobar pneumonia 2000, bronchopneumonia 700. This is how epidemiological questions of microbiology can confuse people. When they ask you, what is the most common cause of traveler's diarrhea? You can go for E. coli ETEC and E. coli EAEC. But if they ask you, what is the most common traveler's diarrhea cause in children, the answer becomes rotavirus. What is the most common viral cause of traveler's diarrhea in case of adults? It becomes Norwalk virus or calicivirus. This is why you should be able to be very clear about the question. Once you nail the question properly and understand them, then your answers will be absolutely ironclad. Ironclad answers will absolutely be what taking you forward in life. That is why please listen carefully, think. This is the most important aspect you should be trained in before you go for the exams. Aditya, no man, I'm not trolling you. You haven't seen me troll. I think Mukundan has seen me troll. Isn't right? Mukundan, I have trolled people and you have seen it, right? I don't know whether Mukundan also was there because when I troll people, you should come and see in a live class, especially in offline class, because in online class the whole world will be seeing, right? So generally we don't troll much. Oh, yeah. Okay, okay. Then I would have definitely trolled you, I guess. Then I would have definitely trolled you, Aditya. Okay. Answer for this question to both of you. Okay, answer this question. In experimental study, if a young researcher extracts a monoclonal antibody that can effectively neutralize the effect of beta hydroxymyristic acid component of a bacteria in vitro and later in vivo, sepsis caused by which one of the following sets of bacteria is most likely to be improved following administration of this antibody? In the study, a young researcher has produced a monoclonal antibody, and the monoclonal antibody is meant to target the beta hydroxymyristic acid. Now, if the monoclonal antibody can target the beta hydroxymyristic acid and blocking it, then you tell me it can be helpful in which combination of the infections A, B, C, D? Okay, Mukundan says A, Bordetella pertussis and Clostridium perfringens. Anything else? Anybody else? Have you come across this story of Sherlock Holmes? If somebody goes and asks Sherlock Holmes, Sherlock, how did you actually crack this case? He'll say, no, I won't tell you. Generally, he never tells the people how he has cracked a case. They ask him, are you so selfish? You don't want us to learn. Why are you doing all these things? Sherlock says, see, I don't have a problem in revealing how I cracked this case. But the moment I tell you how I cracked this case, you'll start losing the respect I have. Because when I tell you the flowchart or the thought process I used in breaking the case, then you will think, yeah, of course, even I would have done it. Maybe I didn't think about this, but I would have also done it. Once you do that, my heroism is actually coming down. That is why I never tell people how I have cracked it. Because the moment people actually know how it was cracked, they think they also can do it. That is the most important infection that is plaguing the human beings all over the world. Now, this is also a similar kind of thing. Now, if I tell you how to crack this, it will become dead easy for you. That is why you have to be focusing on the concept. Once the concept is ironclad, rock solid, you don't have to worry about any kind of major composition or problem in case of infectious disease, because every bacteria has its own lifestyle and every bacteria has its own intelligence. The problem is that you have to ask yourself, what is the bacteria good at and what is the bacteria good at and bad at. Now, if you're going for the interview, they'll ask you, what are your strengths? They'll also ask you, what is your weakness? And why do they do that? If your weakness is more than the strength, you should not be given the job. If your strength is more than the weakness, you will take you up for the job and then try to focus on your weakness and convert the weakness into strength, or they'll mask the weakness in such a way you will not be showing it in the work that you're doing. The quality of the work is not affected. That is why. Now, in case of bacteriology also, ask yourself, what is the strength of the bacteria which you have to hit against? And what is the weakness of the bacteria which you can utilize to make sure you can survive against the bacteria? That is what you need to know to solve any kind of infectious disease based question. So when you know the strength, you know how the organism operates. When you know the weakness, you will know what is the door through which you can operate. Now here, I spoke about beta hydroxy myristic acid. I spoke about beta hydroxy myristic acid. Now, what is this beta hydroxy myristic acid? It's a component of lipid A, which is a component of lipopolysaccharide. It is a component of lipopolysaccharide. Now, let me tell you this. In case of a gram-positive organism, the gram-positive organism always secretes an exotoxin. Exo, the one that comes out. Exotoxin means a toxin that is released by a bacteria by a secretory process, not by forcible pulping, not by forcible destruction of the organism and releasing it. The organism by itself has a system through which it can secrete the toxin. Only then you call it as an exotoxin, done by a secretory process. By a secretory process. Gram-positive organism releases exotoxin by a secretory process. What about a gram-negative organism? A gram-negative organism operates with both exotoxin and endotoxin. And here also, it will follow the same principle of being secreted by a secretory process. While endotoxin is something present in itself as a component of cell covering. As a component of cell covering. Now, think about the cell covering of both the gram-positive and gram-negative organism. Yes, very good, Mukundan. Now, look at this. When it comes to the cell covering, if it is a gram-positive organism and a gram-negative organism, this is the order in which you see from outside to inside. If I draw a circle here and this is the center of the organism, I make a pizza sector. Like a pizza sector, if I make, in this sector, I'll take this out and show you. This will be the centermost. This is the outermost. So this is the outer part. This is the inner part. Likewise, this is the outer part. This is the inner part of a gram-positive or a gram-negative organism. The outermost layer of a gram-positive organism is made up of a very thick peptidoglycan meshwork. And then you have a cell membrane. That's all. It has a peptidoglycan meshwork. It's a meshwork, like a huge amount of sieve is present. It contains a peptidoglycan meshwork and the inner layer is cell membrane, nothing else in between. Okay. Now, in case of a gram-negative organism, you have a cell membrane. Then you have a very thin peptidoglycan meshwork, as you saw in case of a gram-positive organism. Again, you'll have a cell membrane. Now, in case of a gram-positive organism, you had two distinct layers. In case of gram-negative organism, you have the same two layers. That is, one is the cell wall, the other is the cell membrane. But the cell membrane has been split into two. Now, you have an outer cell membrane, inner cell membrane. Both of them are sandwiching a cell wall. So, here in gram-negative organism, you have an outer membrane, cell wall, inner membrane. Now, this outer membrane is the outermost layer of a gram-negative organism, while the peptidoglycan meshwork is the outermost layer of a gram-positive organism. For a gram-positive organism, peptidoglycan meshwork is the most outermost layer. In case of a gram-negative organism, the outer membrane is the outermost layer. Now, what is the peptidoglycan layer made up of? The peptidoglycan layer is made up of peptide component and glycan component. The peptide component is made up of D-alanine and D-ala peptide, then D-glutamate. All these are the amino acid and peptide components. The glycan components are made up of N-acetyl-muraminic acid and N-acetyl-glucosamine. So all these things are a combination. One is the peptide component and glycan component. But what is the outermost layer of a gram-negative organism made up of? The outer membrane. That outer membrane is made up of lipopolysaccharide. Now the beauty is the outer membrane is the lipopolysaccharide, which is the endotoxin. Now here comes a question. What is the question here? Can all lipopolysaccharides mean to become endotoxin? No. Like all the areas, lipopolysaccharides can be endotoxin? No. Here, the lipopolysaccharide, if it contains lipid A, only then the LPS is equal to endotoxin. If it is non-lipid A, you call it as lipid B, lipid C, lipid Sachin Tendulkar, whatever it is, if it is not lipid A, then the LPS is not equal to endotoxin. See, if it is not lipid A, still it is a lipid. It can be lipid B, lipid C, lipid D, etc. Whatever it is not lipid A, still it is lipid, but not equivalent to endotoxin. So remember, we have lipid A, non-lipid A. Lipid A is LPS if it is endotoxin, and if it is non-lipid A, LPS is not equal to endotoxin. These are the two things I would want you to remember. Now coming to the point here. Here you are speaking about beta hydroxymyristic acid, which is the lipid A. Along with that, if polysaccharide is present, it is lipopolysaccharide. Only if it is lipid A, this lipopolysaccharide is endotoxin. Now, what is the question? You're looking for a monoclonal antibody which is trying to block the lipid A portion of the lipopolysaccharide, because of which the endotoxic property can be brought down. That can be a property of only gram-negative organisms. Now, look at option A. This Bordetella is a gram-negative organism, but Clostridium is a gram-positive organism. Now, you can think of Escherichia coli, you can think of Escherichia coli and Neisseria. Both of them are gram-negative organisms. Next, think of Pseudomonas aeruginosa, a gram-negative organism, but Bacillus anthracis is a gram-positive organism. Next, think of Staph epidermidis, which is a gram-positive organism. Staph aureus, a gram-positive organism. So the best answer would be B. Why? Because Escherichia coli and Neisseria, both of them are gram-negative organisms, and both of them will contain endotoxin. Both of them contain lipopolysaccharide. If the endotoxin is a lipopolysaccharide, the endotoxin contains the lipid A as the part of LPS. The lipid A is beta hydroxymyristic acid, which can be blocked by the monoclonal antibody, because of which it can be useful against these two organisms. Now there is a corollary information also. I said lipopolysaccharide is made up of lipid A plus polysaccharide. If lipid A is the same, only then it is equivalent to endotoxin. Instead of lipid A, if I have lipid B, C, etc., it is not endotoxin, I told you, right? What about the polysaccharide? A polysaccharide can be variable. It can be anything. For example, glucose, fructose, glucose, fructose, glucose, fructose, glucose, fructose, up to 10 is also a polysaccharide. Glucose, 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 all the 10 of them are glucose is also a polysaccharide. All the 10 of them are fructose, also a polysaccharide. Fructose, glucose, glucose, also a polysaccharide. The polysaccharide can show any kind of variability, but the constant part of LPS to be pronounced as endotoxin should be the lipid A. Now that means in case of Neisseria, there is one extra information. In Neisseria, what endotoxin you have is not LPS, it is LOS. In Neisseria, gonococcus and meningococcus, still lipid A, beta hydroxymyristic acid is the same, but instead of polysaccharide, you have oligosaccharide. This is the variation. Now I'll tell you one more variation in this. Now think of Bacteroides. In my Instagram story on the Biochem ASM page, I have just put a video to show that we are coming for live class. In that, there is a video starting statements about the Bacteroides. In Bacteroides, you have LPS, but that LPS is not equal to endotoxin. I told you, right, what amounts to endotoxin? The lipid A. Because Bacteroides has the LPS, but the L is not equal to lipid A, the LPS is not equal to endotoxin. So Bacteroides is almost a non-toxic organism. That is why the human body is able to keep the organism as a commensal. That makes Bacteroides the most common anaerobic commensal of the human GIT. Now, if the human GIT is attacked by injury or by any trauma or even by surgery, the same Bacteroides can gain virulence in spite of the absence of endotoxin. Still, it is capable of causing sepsis. But Bacteroides is the least common cause of sepsis. Least common cause of sepsis. Now, let me summarize whatever we have spoken till now in a fresh page. Look at this concept. Generally, in case of a gram-negative organism, the outermost layer is the outer membrane, which is made up of lipopolysaccharide. In most gram-negative organism, LPS is equal to endotoxin. Why? Because in the LPS, the toxic component L is equal to lipid A. In case of Bacteroides, we are going for exceptions. This is exception number 1. Bacteroides LPS is equal to endotoxin is not correct because L is not equal to lipid A. Now, what about Meningococcus and Neisseria? Another exception is that here the endotoxin is equal to LOS and not LPS. Because the carbohydrate component can be variable, it doesn't matter in case of Neisseria. Did you understand this, all of you? A patient is known to have recurrent trouble with Aspergillus-induced pneumonia, lymphadenitis, osteomyelitis, brain abscess, and also he is him to have Burkholderia cepacia complex recurrent infection that causes pneumonia, sepsis, candidal sepsis or species causing sepsis, soft tissue infection, liver abscess. Which of the following might be defective in the patient? A patient is known to have recurrent trouble with these kind of problems, all the three. He has recurrent Aspergillus infection, recurrent Burkholderia sepsis infection, recurrent candidal infection. So, if he has all these things, among the following, which one will be defective in the patient? What is your answer? Anybody? Okay, Mukundan says D. Anybody else? Okay, there is only one answer, and the answer is NADPH oxidase. Can you tell me, Mukundan, why you chose this answer? Give me any answer, anything that you feel like. Why did you choose this answer? Excellent disease. Very good answer. It is called as chronic granulomatous disease. This is a defect in phagocytosis. Very good, Karthik D. You're also correct. See, chronic granulomatous disease is a condition where the patient has defective NADPH oxidase. In case of the granulocytes, neutrophils and macrophages, you will require the NADPH oxidase to produce free radicals. Which can destroy the organism. I told you right in the beginning, what is about a strict aerobe? A strict aerobe is capable of tackling all kinds of free radicals, while a strict anaerobe is not capable of tackling any free radical. So now, if I'm going to use free radicals being produced, now which kind of organism can be easy to destroy? Aerobic or anaerobic? If my body is actually producing enough number of free radicals, I'll be able to easily clear which group of organisms, aerobic or anaerobic. If free radicals can be produced, which group of organisms can be destroyed easily? Aerobic or anaerobic? Which organisms can be easy to destroy using free radicals? Yes, excellent. Anaerobic organisms are easy to destroy because they cannot know how to handle the free radicals. Now, imagine Aspergillus, Burkholderia, Candida are all organisms who have aerobic nature. Aspergillus, Pseudomonas, Burkholderia, Candida. Apart from that, think of MTB. All these organisms have aerobic nature. If they have aerobic nature, tell me what are the enzymes I taught you today? What are the enzymes I told you that aerobic organisms have? superoxide dismutase, catalase, peroxidase, and cytochrome reductase. These four enzymes can be carried by these organisms to act as an aerobic organism. Now, if your body's modus operandi, that is your body's mechanism of action, is to produce a free radical and throw it like an acid attack on the organisms, the free radicals will come and hit the organism. Once the organism are hit by the free radicals, then they generate these enzymes and they will try to tackle the free radicals. So if a patient is having infection because of these organisms, the organism will be here, the immune response will be here, both of them will be tackling each other like an attack like this. Not oxidase, we are focusing on cytochrome reductase. Cytochrome C oxidase belongs to electron transport chain. Now these are the ones who are important for free radical changing, that is cytochrome reductase. Now look at this, when both of them are equally matched, the person is able to fight the organism. He's fighting tooth and nail with the organism. But if the patient is having defective NADPH oxidase, then you will not be able to produce enough amount of free radicals. So all these organisms can easily escape the attack. That is why these are dangerous. Okay, now what is the answer for this question? A patient who was lodging Corynebacterium diphtheriae since childhood suddenly develops diphtheria and he has no history of immunization with diphtheria vaccine. The sudden conversion of his status can raise the suspicion of which of the following to have happened in the bacteria. Conjugation, transduction, transformation, translocation. Which one? Okay, Mukundan says C. Anybody else? Is Aditya there? Is Dr. K for Valimi update is still here? If Karthikar is there, choose any option. He also says C. Okay. Now the answer is transduction. Why transduction? Let me tell you this very clearly. Staph aureus drug resistance. Corynebacterium toxin formation and ETECs, heat labile toxin or heat stable toxin. All these three plus botulinum toxin of Clostridium botulinum. These four are spread from one bacteria to the other bacteria by transduction. It is by a bacteriophage mediated vector activity. Okay, these four are golden points to know about transduction, which is bacteriophage mediated. If you're okay, shall I teach you all these four in a very short format? Conjugation, transduction, transformation, and translocation. Okay, let's do it very quickly. In a very short format, we'll do this. Look at this. We have bacteria A and bacteria B. In all the four situations, we are going to use only two bacteria. Now, this is bacteria A, this is bacteria B. Now, you have a virus who's capable of infecting a bacteria, which is referred to as a bacteriophage. This is a very important point because which viruses can act as bacteriophage? Only DNA viruses can act as bacteriophage. This is an MCQ. And these bacteriophages, when they attack the organism A, now they will go into the organism A and liberate their chromosome. Now bacteria A will also have its own host chromosome. Some extra chromosomal DNA also will be present. Now when a virus has to go inside the organism, it has to multiply, then it has to break open the chromosomal ring of the bacteria, and the viral chromosome and the bacterial chromosome will mix with each other and they give rise to progeny viruses. Now you can have three types of viruses. You can have three types of offspring viruses. One virus is carrying the parent DNA only, that is the bacteriophage content only. Now another group of viruses can have only the host chromosome of the bacteria only. Now the third group of virus can have a combination of both the viral DNA and the bacterial DNA. Now if at all I say organism A is toxic or organism A is drug resistant, the toxicity is also coded on a gene. The drug resistance is also coded on a gene. I say organism A is toxic or organism A is drug resistant. The opposite of that is organism B. Organism B is non-toxic and organism B is drug sensitive. Now, if the organism B has to survive in an atmosphere, it has to turn like organism A. It means the non-toxic organism should turn into a toxic organism. A drug-sensitive organism has to turn into a drug-resistant organism. These two things to happen. Now, you actually want these two information from the gene to go from organism A to organism B. How will that happen? Now, when the vector has actually bacteriophage has gone inside and has come out, there can be three types of the offsprings. One offspring can contain only the viral chromosome itself without any change. The other offspring can contain only the bacterial chromosome. The third can have the mixture of both bacterial and viral chromosome. These three are the types of chromosomes. Now tell me, which viral particle will not be able to transform the organism B? I'll write it here. You have A, which has only the bacterial chromosome. We have B, which has the viral chromosome. We have C, which has the combination. Now, out of A, B, and C, which one will not be able to transform the organism B like A? I'm having three types of viruses coming out of organism A. One virus contains purely the, that is A contains purely the bacterial chromosome. B contains only the viral particle called as bacteriophage. And C contains a combination of both the bacterial and the viral component. You tell me, among the three, which one is not capable of transforming the organism B? No. I'm asking you something else. I'm saying a bacteriophage is entering into a toxic organism. It has to bring some toxic property into the organism B. Now, only then the organism B will be like organism A. Now, there are three types of viruses. Among the three types of viruses, which one will not be able to change the organism is what I'm asking you. A contains pure bacterial chromosome, that is organism A's information only. B contains pure viral information only. C contains both bacterial plus viral information. Among the three, which one is not capable of changing? Excellent pulse precision, because B is carrying the virus. Virus is a vector. When the vector comes and leaves as just the vector itself, it has not taken any information from organism A. But the viral particle A and the viral particle C will take some kind of information from the organism A and give it to organism B. Now imagine organism B will have its own chromosome, but any information that has been taken from organism A and dropped inside will remain as extra chromosomal DNA called as plasmid. Now, whenever a gene information is present in the plasmid, it will not be transcribed, not be translated. Only when this information enters into the chromosome, it can be transcribed and translated. Now, as long as the toxic information is staying in the extra chromosomal plasmid, it has the information about the toxin, that is the organism B is still non-toxic. It has the information about the toxin, but it is not toxic yet. But you have to wait for this information to integrate with this information so that the non-toxic organism has become a toxic organism. So what is the key information here? We have an organism B, we have a chromosome, we have an extra chromosomal DNA which contains the toxic information, which is marked in red. If this red color is still not a part of the chromosome here, then the organism B has still not become toxic. How can organism B become toxic? When the organism B lyses because of the entry of the virus. That is, the virus has gone to A and then came out and has gone to B. Now, because of the entry of the virus into the organism B, if the organism B is broken down, it is called as lysis. When the lysis is happening, it is called as lytic phase. And if the virus is capable of causing the lysis, then that virus is called as lytic phage. And when the lytic phage is entering inside, the lytic phase happens, lysis happens. Now, recombination of everything happens in such a way. Recombination of everything happens in such a way that now this information has gone to the host chromosome. And when this information has gone into the host chromosome, now the organism B has changed into organism A property. This is called as conversion. And how did the conversion happen? Because of the lysis. So lysis induced conversion is called as lysogenic conversion. Now, if this information was drug resistance information, now the drug sensitive organism B has become drug resistant organism B. Now, if it was toxin, the non-toxic organism B has become toxic organism. Now, this is called as transduction, that is information change that is happening because of free bacterial intermediate. It is because of bacteriophage intermediate. Did you understand this? Hello, Dr. Vivek Shetty. Thank you. I think you will be having the next class in the yours is the first class of the clinical postings. All the very best for your clinical class, Dr. Vivek Shetty. Did you understand this? Mukundan, Pulse Physician, Karthikar, Wonder Cafe. Oh, sorry. Lysogenic conversion. Lysogenic conversion means because of the information transfer from the plasmid to that area, now we have converted the non-toxic organism into a toxic organism, or a drug-sensitive organism into a drug-resistant organism. Now, transduction is the process of a bacteriophage going from one organism to other. In that process, you have converted a non-toxic organism into a toxic organism, that is called as conversion. And the conversion happened because of lysis. Lysis happened because of transduction. When lysis happened, interchange and mixture of the genetic information happened, because of which lysogenic conversion has happened. So by lysogenic conversion, Staphylococcus aureus can get drug resistant, and Corynebacterium diphtheriae can actually produce the toxin. In this case, initially you were affected by a non-toxic Corynebacterium diphtheriae, which was just a commensal in the body, but because of transduction, Corynebacterium diphtheriae is now producing the diphtherotoxin. Once the diphtherotoxin is capable of coming, then the organism produces diphtheria, and because the person was able to have no immunization, he is suffering from diphtheria now. And the process was because of transduction. Did you understand this, Mukundan? If you have understood this, then the remaining parts will become easier for you. Let me tell you about transformation. In transformation, it is purely free DNA transfer without any kind of vector intermediate, and happens between compatible bacterial pairs. Now, let me ask you a question to you. We have bacteria A, bacteria B. We have bacteria C, bacteria D. Bacteria A is Streptococcus pyogenes. Bacteria B is Staphylococcus aureus. Bacteria C is again Streptococcus pyogenes. Bacteria D is chlamydia. Now, among these two pairs, which pair is better, AB or CD? Among these two, who is more closer in relationship? Both of them are compatible. Which jodi is a compatible jodi? A and B or C and D? A and B. Why you chose that? Because Streptococcus pyogenes is gram-positive, Staphylococcus aureus is gram-positive. Streptococcus pyogenes is a cocci, Staphylococcus aureus is also a cocci. Streptococcus pyogenes and Staphylococcus aureus, both of them are typical bacteria. But in case of Streptococcus pyogenes versus chlamydia, Streptococcus pyogenes is typical, chlamydia is atypical. Pyogenes is extracellular, chlamydia is intracellular. Streptococcus pyogenes is toxic, chlamydia is non-toxic. Streptococcus pyogenes is gram-positive, chlamydia is gram-negative or gram-variable. So these two are not compatible, while these two are compatible. The free DNA transfer can easily happen between these two organisms. Now, how will the free DNA transfer happen? I have organism A, organism B. Organism A has a chromosome, organism B has a chromosome. Now, because of age-related changes or because of environmental destruction, if the bacteria A is burst into pieces, now the DNA of the A will be floating in the atmosphere. For example, the water, these organisms are floating. Now, the DNA of bacteria A will go and knock on the walls of B. Because B realizes this DNA belongs to an organism who's similar to this, the DNA will be welcome. Now, this information can actually stay in a separate fashion, or they can integrate with the host chromosome. So once the information integrates with the host chromosome, the information from A enters into B, and B starts behaving like A. B is transformed into A. That is called as transformation. Now, what is conjugation? Now, this is organism A, organism B. Organism A has its own chromosome, organism B has its own chromosome. But when A and B are coming together, if A is having the drug resistance gene, now A will start extending its pilus towards the organism B. Once the extension happens, you will be able to notice that between A and B, a small tunnel is formed. Now, there is a nick in the DNA. And once this DNA happens to have a nick, now it becomes a linear DNA. which is carrying this information. Now this DNA will start extending and traveling through the tunnel and enters into the organism B and again recircularizes. Once this happens, again this tunnel disappears and the organism A will have its own structure. Now it again recircularizes. When this information went inside and went for circularization, the whole DNA was replicated. So the drug resistance information is also replicated. This is a plasmid, and if it integrates with the host chromosome, organism B also gets the information of organism A. This is called as conjugation. Now, in case of transformation, it was free DNA transfer between compatible bacteria. In case of conjugation, it may compatible bacteria is better, but even in non-compatible bacteria it can happen. But B is actually getting the information of A by a physical contact, and that physical contact is established by a pilus. This is called as conjugation. Now comes another question. So if conjugation is capable of using a pilus to send the drug resistance information or toxin information, then what is sexduction? Sexduction belongs to one of the three. That is transduction, conjugation, transformation. Sexduction belongs to one of the three. Sexduction sounds like transduction, but it is not related to transduction. Sexduction is a variant of conjugation. But in conjugation, you are transferring information of drug resistance or toxicity. But in sexduction, you transfer sex information. Now, what is the sex information? Imagine, in case of higher organisms, what is a sexual activity? Now, a male and a female will come together. A male will give some genetic information, a female will give genetic information, fertilization happens, zygote forms, it can give rise to either male or a female. That is called as a sexual activity. Imagine this weird form of sexual activity where a male is coming and a female is coming together. A male is giving something to the female, female is not giving anything, but the female is taking something from the male. The male remains a male, but the female also turns into a male. That is what is a property of sexduction. Now, in case of sexduction, again, like conjugation, there is a physical contact, but this physical contact is in fact becoming a sexual contact. I repeat, the physical contact in case of sexduction is a sexual contact. So you can't use any ordinary pilus, you will use sex pilus. And when that happens, you will be having the tunnel formed by the sex pilus where a particular F plus fertility factor which is present in the chromosome is again going for a nick and extending and is carrying the F plus chromosome here. Now, when the organism is having the F plus chromosome, it is equivalent of a male. If it is having an F minus chromosome, it is equivalent of a female. Now, this F plus, the fertility factor, when it goes from this organism to this organism, the F minus turns into F plus. This is called as sexduction. Here there is transfer of sexual information. Did you understand this? So, I'll summarize this. In case of transduction, information of drug resistance and drug toxicity both comes from organism A and can go to B using a bacteriophage intermediate. When there is no vector but a free DNA is transformed and A is actually giving information to B and B becomes like A, that is transformation. If A and B are coming together, physical contact of pilus is present, the drug resistance and toxicity goes from A to B through the channel of the pilus, it is called as conjugation. And through the same tunnel, which is sex pilus, sexual transformation, sexual information is being transferred, it's called as sexduction. Did you understand this, all of you?